Hello, welcome to my YouTube channel. Do you want to know how to effectively take care of patients with COPD? Do you want to have a greater understanding of what COPD is and how to diagnose it and differentiate it between COPD and asthma? If you already know, please share your experience in the comment section below. But if you don't know, this video might be useful for you. So please consider watching. Thank you very much. So in this video, I'm gonna put the timestamps of all the different sections. We're gonna begin of defining what COPD. So COPD stands for chronic obstructive pulmonary disease. And what is COPD? COPD is a name of lung condition, so it's a collective name that causes breathing difficulties for a patient, which can include emphysema or chronic bronchitis. We're gonna delve that deeper in another video. The main causes of COPD. The main cause of COPD is smoking, fume and dust, experience especially at work, so frequent exposure to it, air pollution, and genetics. So anything that has a negative reaction to the lungs is the main culprit for. How can you diagnose COPD? So you can diagnose COPD by performing a spirometer, and with the use of the spirometer, you will get the FEV1 out of versus FVC ratio, and it should be below 0.7. Again, we're gonna delve that much more deeper in the next video, so be tuned for that video. Also talk about the symptoms of COPD. So the main risk factors of COPD is that it is usually affects older generation, so 35 years and above. It's very uncommon to happen to young people, but cases still exist. Well, what are the other symptoms? So other symptoms of COPD is breathlessness and exhaustion. So in COPD patients, you see them, being often breathless at the simplest movement. So it is very difficult for them, to walk up and down, to exercise, even for a short period of time without being breathlessness. They also have a persistent cough, and they also have frequent sputum production in the lungs and wheezing. This can be due to lung conditions which affects the normal functions of the lungs. In the final section of this video, we're gonna differentiate between COPD and asthma. So what is the difference? So how can you differentiate between them? So COPD, a person is most likely to have it if they are a smoker or an ex-smoker. Whereas in asthma, it is possible but not frequent. And again, like we said, symptoms under 35, it is rare in COPD, but it's very frequent in asthma. A patient is going to have a chronic productive cough, very commonly in COPD, but uncommonly in asthma. Breathlessness is going to be progressive and persistent as the conditions progress, as the COPD progresses, whereas in asthma is variable, so it's not frequent. Nighttime waking up breathlessness is uncommon with COPD because they are like CPAP, don't they? And for asthma, it's very common for them. Significant day-to-day variability of symptoms is uncommon for COPD, as we have suggested. It's because the symptoms is persistent, progressive negatively as the patient progress, but very common for a patient with asthma. Okay, so this is the end of my video. Thank you for watching. If you have any questions, please ask them below. And thank you for being my first viewer. I hope you like it. For any suggestions or anything how I can improve, please tell them in the comment below. But if you do like it, please consider liking and subscribing so you don't miss another video or my part 2 of this series. And again, thank you very much, and I'll see you later in the next video. Thank you.